Mr. Mango, good to see you again. Looking through your x-rays here, and I have some bad news and then some worse news. What would you like to hear first? Yes. I guess I'll hear the bad news first. Well, Mr. Mango, the x-rays are showing bone on bone osteoarthritis in that knee. Oh God, that sounds terrible. What's the worst news? The worst news is it's the worst I've ever seen. We're gonna have to operate, unfortunately. So let's go ahead and have you head to the front desk, talk to Debbie. She's going to get you set up with an appointment, okay? Is there nothing else that we can do to operate? There's got to be something else that we can try first. I mean, I guess we could do some physical therapy first, but bone on bone, what's PT going to do for you? Have you or any of your family members dealt with this firsthand? Well, if so, then this video is for you. Dr. Mango here, and welcome back to the channel. Today, what I want to talk to you guys about is dealing with osteoarthritis of the hip and knee, and maximizing your mobility and minimizing the risk of needing to get that total hip or total knee replacement. I'm going to go ahead and share a lot of insightful tips for you, so stay tuned. Osteoarthritis is defined by a loss of cartilage in our joint space, and it can occur in any of our joints, but the most common ones are going to be in our hands and then in our knees and hips. It can often lead to pain and stiffness as well. So let's take a deep dive into the knee joint and see what's going on in there. So here you have your knee joint. It's made up of your femur and your tibia, and then your fibula is off to the side down here. Now these two bones here articulate with one another with a layer of cartilage in between the two, and that's going to allow it to glide smoothly across one another so that it doesn't bump into the other bone next to it and cause some pain as well as some stiffness. This is going to be really, really important because as time goes on and you have more wear and tear on the joint, you begin to have breakdowns of that cartilage, and that's what's going to cause that pain and that stiffness if you're standing still or sitting still for a long period of time. One of the primary roles of our muscles is to move our body, and one of the secondary roles of that is to support our joints, which is going to be really helpful in minimizing our osteoarthritis buildup over time. Picture this scenario. You're walking along the street, and a certain amount of force is getting placed onto your joints every single step that you take. If our muscles are weak, what ends up happening is a lot of that load is compressing into that joint, leading to a lot of banging in the joint, and that's going to lead to some wear and tear over time. But if your muscles are strong, it's going to absorb some of that shock and minimize the degradation of the cartilage in that joint. This is such a key component to minimizing the progression of your arthritis over time, especially as we age. So this is a great thing to do if you don't have that much arthritis built up right now. But what do you do if you already have some arthritis and you start to feel some of that pain and stiffness that I was mentioning before? Well, this next strategy is going to be very helpful for you. Now, if you have arthritis in your knee, what you're going to experience is this. Even if you're sitting for 10 or 15 minutes, that knee can start to feel pretty painful and stiff, and when you begin to stand up and take your first couple of steps, they're going to be quite painful as things loosen back up a little bit. Now, a good strategy to overcome this is when you're sitting, every few minutes or so, just kick your knee out straight and bend it, and just do that a few repetitions every 5 minutes or so. That will keep that knee joint lubricated and nice and loose, so that when you're ready to stand, you're ready for it. No matter what age you are, the most important things for you to do are going to be to stay active as much as you can and for as long as you can at the end of the day. Because all of that activity, at the very least, is going to keep those muscles working and keep them nice and strong for you. If you like the content, please feel free to like, comment, and subscribe to the channel. And let's keep the fun in functional. I'll see you in the next one.